you've touched right now on the point of patients refusing to take their medication. What can we do as children when and I'm going through this right now. My mum is 72 and she's been stable, and all of a sudden, out of the blue, she said, I'm not taking medication and you can't force me. And beyond that, it's just going into a war that you don't want to, because they become very defensive. What can we do?
That's such a wonderful question. And you're speaking to the frustration and the despair that we as children and family and loved ones feel, because I think she's right. There is nothing you can do until she's ready.
Wow.
So I know your mom is in Australia. I know that here, I don't know what you can do. There are laws that say we can't force medication on people here unless they're a danger to themselves or others. And that's often not the case. Not everybody who is schizophrenic is a danger to themselves or others. In fact, it's a small minority.
Exactly.
And so, I'm with you. What can we do?
Yeah, it's really tough because I live in Mexico City and my brother is the caretaker, and he called me, Sandy, she's refusing to take medication. And it just breaks your heart because everything that you gain. I'm sorry, I'm going to get a little bit emotional.
I think that's allowed.
There's this profound sadness because everything that has been channeled toward getting her stable and achieving that, and then all of a sudden for that to go out the window because I just don't want to anymore.
A whim. Yeah.
Yes, and I feel for my brother because it's a frustration that we as rational people, it's like we cannot understand it. And in her mind, it's like, leave me be. And the doctors have said that if she has refused and she's not a danger to anybody, we cannot make her take medication. And she literally has to be at a point where she's committed for you to be her guardian. So we're waiting literally for things to get out of control.
That's right.
Yeah.
That's how everything's set up right now.
Yes.
I don't. There was a woman in my book whom I interviewed, and she's an attorney, and she talked about, she does have guardianship of her mom now as an adult, but she talked about her mother. Every time she went in the hospital, she would get better and be functioning well, and come home, shut the front door, and say, "I'm not taking that medicine anymore."
Wow. Yeah.
And then, boom, off we went onto another downhill slide. And, sometimes you can understand why the schizophrenic person doesn't want to take medications. They can be very sedating. My own mom was on Thorazine for 3 years between my age 7 and 10, and she did nothing but stare at the wall that I can remember.
Yeah.
That's all she did. And that was pretty standard for Thorazine takers back then. And when I was 10, she decided all the doctors were in a plot against her to keep her sedated. Well, of course, that wasn't true, but I could see where she got really sick of being so sedated, and she stopped taking medication at that point. So that's another complicated issue.